Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth Calcium Score Could Save Your Life. And trust me, it's juicier than your cousin's peach cobbler. What if I told you there's a simple scan that can predict your heart attack risk years before symptoms appear, but 90% of people have never heard of it? Yep, entirely true. I can't make this stuff up. Today we're revealing this hidden weapon in heart disease prevention. And folks, this one's a game changer. So what exactly is a calcium score? Think of it as your heart's credit report, but instead of tracking your spending habits, it's tracking calcium buildup in your coronary arteries. Now, before you start reaching for antacids thinking calcium is something you ate, let me explain. This calcium isn't from that glass of milk you had this morning. This is the kind of calcium that shows up when your arteries are trying to heal from damage. Kind of like how your body puts a cast on a broken bone, except your arteries use calcium as their repair material. The test itself is easier than getting through airport security. It's a CT scan that takes about 10 minutes. No needles, no contrast dye, no fasting, no prep work. You just lie there while the machine takes pictures. The scan gives you a number from 0 to 400, and beyond that directly correlates to your heart attack risk. I tell my patients the calcium score is like a crystal ball for your heart. It shows atherosclerosis before you feel anything wrong. Here's the beautiful part. A score of 0 means your risk of having a heart attack in the next 5 years is practically zilch. But as that number climbs, so does your risk. A score over 100 puts you in the moderate risk category, and anything over 300 means we need to have a serious conversation about your future. Maybe I should see you in the clinic. We need to talk. Now, who should get this test? Anyone between 40 and 75 with intermediate risk factors. I'm talking about people with family history, high cholesterol, diabetes, or a smoking history. If you're sitting on the fence about whether to start medications like statins or make aggressive lifestyle changes, this test can push you right off that fence in the right direction. It's also perfect for those folks who feel healthy as a horse but have a family tree that looks like a cardiac care unit reunion. But here's who shouldn't get it. If you already have known heart disease, we don't need this test telling us what we already know. And if you're a 25-year-old marathon runner with perfect everything and no family history, you're probably not our target audience either. Let me tell you about Sarah, a 52-year-old marathon runner who walked into my office feeling pretty invincible. Perfect cholesterol numbers, ran 5 miles every morning, ate kale like it was going out of style. She only got the calcium score because her husband nagged her about her father's heart attack. Well, wouldn't you know it, her score came back at 180. That's significant plaque buildup hiding behind all that fitness. Sarah's jaw hit the floor harder than a dropped dumbbell. We immediately started her on medication and intensive monitoring. Her follow-up scan showed the plaque had stabilized, and we potentially avoided what could have been a widowmaker heart attack during one of her morning runs. You see, all that fitness was masking an underlying genetic predisposition that was quietly building up trouble in her arteries. Sarah's story illustrates something I see all the time. People thinking they're bulletproof because they exercise or have good cholesterol numbers. But heart disease is sneaky. It's like that relative who shows up uninvited to Thanksgiving dinner. You might not see it coming, but it's been planning this visit for years. The calcium score strips away all the guesswork and assumptions. It's objective, it's accurate, and it's incredibly predictive. Think of it as your heart's early warning system, like a smoke detector for your coronary arteries. So here's what you can do today. If you're over 40 with any heart disease risk factors, march into your doctor's office and ask about a calcium score test. The cost typically ranges from $75 to $150, and it's often covered by insurance. That's less than what most people spend on their monthly streaming services, and I guarantee this will be more entertaining than whatever's trending on Netflix. One simple number could completely change how you approach your health. It might be the wake-up call that motivates you to take your medications seriously, hit the gym consistently, or finally give up those cigarettes you've been meaning to quit since the Clinton administration. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.